Welcome everybody. So today we are once again in the pain series. We're talking about neck pain today. So we have 3 parts of neck pain, and today we're going to start with part 1. I'm Dr. Kevin.
I'm Coach Sean.
And we're the FitHealth pros. So the neck is an area between the head and the thorax, so that we call it the cervical region. And there's multiple compartments which can have issues that lead to pain. So I think the most common things are going to be poor posture, overuse syndromes, and then different types of trauma or injuries there. So again, so part 1, we'll go into the anatomy of the neck. So Sean's going to talk about that a bit. Symptoms, when to get medical help, how to get a diagnosis, and the diagnostic tools that are used, and then even some specialists and different doctors that you want to see. And then part 2, if you're going to keep watching, and we would appreciate it if you do because you're going to learn a lot,
Yes.
is going to be the different types of neck pain. And that's where we really get in and address, I think that what most of my patients bring to me and the different types. So we'll probably address something that somebody out there has already. So we'll talk about those. And then we'll get into what therapies, what medications, if necessary, what home remedies, and then how to prevent these things from even occurring. And that's going to be in part 3.
Which is huge,
Yeah.
which is why we're here in the first place.
So let's go ahead and let's start with the anatomy.
All right, we're jumping right into the anatomy of the neck. Again, like Dr. Fox was talking, there are various compartments which can each have issues. The first compartment we're going to talk about is the vertebral compartment. Now, this is the 7 cervical vertebrae and postural muscles. Now, these provide protection and mobility for the neck. Now, you have this heavy skull on top of this neck, so it needs some very strong muscles in order to get you side to side, flexion, extension, etc. And that is the vertebral compartment. The next compartment will have one on each side. These are the vascular compartments. There are 2 vascular compartments which house the common carotid artery, the internal jugular vein. Now these are for blood flow to and from the head. Also interesting is it also has the series of nerves as well, going up to the brain and going down into throughout the central nervous system, especially the vagus nerve, which is part of the parasympathetic nervous system, which is kind of a slowing down system within that greater central nervous system. We've got rest and digest. It can also slow down the heart rate when you need to calm. That is part of the parasympathetic, the vagus nerve. Last compartment I want to talk about is the visceral compartment. Now, the visceral compartment has the glands. Now, there are a couple different glands here that really affect metabolism, especially the thyroid. We got the thyroid and the parathyroid. Also have the thymus in here as well in the visceral compartment. And they're, in terms of respiration, we've got the larynx, the pharynx, and the trachea. Of course, the voice box is in there as well. So you have both respiration and ability to make sounds and speak, all within this one region. So there's a lot of things that can go wrong.
Right. And let's talk about the symptoms now. So common symptoms, I think, after reviewing the anatomy, a lot of the vascular, those visceral components are on the front, but most people really have most of their symptoms in the back or on the side. Sometimes they'll maybe have a cold or a flu where you do get some symptoms in the front there.
Sure.
But I would say muscle tightness and spasms are going to be the most popular. The inability to move the head, that tightness, that stiffness.
So you're saying it's bad if you're walking around like this?
It is bad.
It's not a good thing?
And driving, it's not too good either. So walk around like that. Yeah.
Yeah.
Now, another big common symptom is going to be headaches. And we're talking about neck pain today.
Right.
But headaches are very associated with neck pain. Now, There are headaches that are just in the front, there are headaches that are just on the side, and there are headaches that are sinus type of headaches. There's even more than that. I mean, we could probably will
do a
whole headache video.
Yeah.
But for the purposes here, the neck headache that goes up and over, if you can think of the tension, so that's called the tension headache.
Sure.
We also will call that a cervicogenic headache.
Nice.
There's the
word of the day.
Word of the day.
Word of the day.
Now, the other thing is going to be where you're just holding your head in one direction over time. Can you think of maybe doing that with working from home on your computer?
Mm-hmm.
Absolutely. So, computer, driving a long distance, keeping that head in that same place, reading, kind of with the neck cricked, personal electronics. Here's the second word of the day.
Uh-oh.
So, new diagnosis came out, I think it was last year, the year before, and it's called text neck.
Text
What do
neck.
you have? You have text neck.
Interesting.
So
your head is down.
Head's down. Yep.
And then it's there for a long time.
Absolutely.
And you've seen a lot of teenagers, I'm sure,
Oh
are
my
getting
gosh.
that early onset too.
Yeah. So, God, I hate to use the word epidemic, but it's a new epidemic in that posture. And again, the symptom is the stiffness and the achiness, and then we have to identify what the cause of the problem is. But whenever you're bringing your head down like that, and if you get in that position where that's your normal,
That's misaligned.
yeah, you're misaligned, you lose your inspiratory volume, trying to breathe, you can't, you got to breathe out here.
Interesting.
And then you can breathe. So you lack of oxygen.
Sure.
And so you can see where, I get pretty hyped about this because we're really saving people from a lot of different health problems when we're just addressing the neck.
Yeah.
Okay, and then you may have swelling, that's another common symptom. And then back to the kinetic chain. So if you have pain on the left side of the neck or pain behind the neck, a lot of times with that dropped head, you may sit and extend and put pressure down into the low back. You may sit crooked because you have a pinch in the neck
One
or the shoulder.
comes up.
And so now you're starting to affect other areas. A really big one is going to be the tension in the traps. And then also that mid-back stabbing thing in between the spine and the shoulder blade that you can't get to, and nobody else knows what to do with it. And I see that all day long. And
It's interesting because everyone has their own specific thing.
Right.
And as we go through this video, you're going to be able to define or pinpoint your specific thing, and it's more common than you know. Your injury or your tightness or your pain or your numbness or your tingling is more common than you know.
Yeah, and that's the thing. Common is the key word there, because people ask me, is this normal? And it's not normal, but it's common.
But it's common.
Okay? So make sure you understand that. If you want to be better than common, then you have to do some proactive stuff. Find out what's going on.
Interesting.
Which leads into when to seek
Part 3 of the video, when to seek medical attention.
Wow. Who wrote these scripts?
I don't know. This guy. With a lot of help from this guy. So, part 3, when to seek medical attention. Now there are, of course, no-brainers when it comes to when are you going to go see a specialist. First off, if you have an injury, say from diving or a motor vehicle accident or a fall, which is kind of funny because I was in an accident a few years ago, and I had talked to Kevin about this, and he said, get a check. Even if you're not feeling it now, right after the accident, get a check, because it doesn't take much force at all to create a soft tissue injury in the neck or spine.
Right, yeah. 5-10 pounds, 5 or 10 miles per hour even, which can give you 5 to 10 pounds of pressure in that, we'll call it whiplash.
Sure.
The insurance industry, they will negate that, but unfortunately physics is physics and anatomy is anatomy, and every study shows that there's soft tissue damage at that force.
Wow.
And because it's force over time. So if you're bonked and your head's not still, it moves. And that acceleration causes that problem.
Yeah, part of these injuries are any kind of outside force out of the normal range of motion can cause any of these injuries going down. And especially, I think, part 2, we're going to talk about types of neck pain, and we'll get into that more in part 2 of this series too. So be sure to ring the bell to know when that video comes out. Some other type of different pains, etc., that you may want to see a specialist about it. If there is a severe pain that lasts for several days, I would hope 2 or 3 days. You don't necessarily want it to go into weeks because it's not going to get better on its own.
Right. And be careful with masking it. It's like, I made it 2 days, but I was on 800 milligrams of ibuprofen. Well,
right.
Don't take that.
Right.
I'm not saying don't take the ibuprofen. I'm saying listen to what your body's telling you, because that's not the truth.
Yeah, your body will let you know if you need to see a specialist. Right. And if you're just numbing out, it's not going away. The inflammation may abate to a certain degree, but the initial cause of the pain, of the numbness, of the tingling is not going to go away on its own. So if you have pain going down the arms and legs, if you have headaches or weakness or numbness or tingling, like I just said, if you have, say, a lump on the neck, even if it's not painful, have that checked out. Because it could be a sign of something else. It could be a sign of, say, cancer of the neck or some other glandular issue that if you let it sit for any amount of time will just get worse and get worse. If you have swollen glands over time and it's not abating, again, see a specialist about that. If you have trouble swallowing or breathing, and this could also go with the glands too.
Right.
If you have a lot of swelling in here, it could, really affect the ability to swallow or breathe as well. If you have an inability to touch your chin to your chest, that is, again, normal versus common. That's one of the things right there that if you can't touch your chin to your chest like that, that may be kind of a new normal for you over time. That's not necessarily where we want you to be for cervical health. Right. If you have pain severe enough, this is another one that is kind of a no-brainer. If you have pain severe enough to cause nausea, fever, or vomiting, go get help. You may even go to urgent care or an emergency room if you need it on this one.
Yeah.
If you are inability to keep fluids, etc., you're putting yourself in a dangerous spot. And then last but not least, which may be one of the most common ones for you, is pain with no apparent cause.
Absolutely.
It's like you have no idea where it came from. You just either woke up with it or you're driving and all of a sudden it's just like, ow.
Yeah, after a long trip, after a plane ride, and those are, people will report to me usually because that's something new or different or they're traveling, but we have a lot that will just say, I don't know.
No idea.
I woke up with it. And so that's probably going to be, probably the most popular there. Outside an auto accident, which they'll come in for as well. But I just woke up with it, or it happened. I've had it all my life. It's just been always there, but now it's worse. So those are the things that, definitely seek out.
And it's got to the point where the pain is so bad that they have to see a specialist. Right. Versus seeing it earlier on and getting it fixed, sort of. And then going into a maintenance plan.
Yeah, again, we were talking about common versus normal. If you're finding that, everyone I talk to has neck pain, so it's very common, but if you don't just want to be one of the commons, I guess.
Yeah, and be in pain.
Yeah, because what that leads to is problems down the road, and it's much easier to keep it improving early on than starting with a severe case.
Right.
Yeah, and then kind of talking about who to go to. Let's get into the specialists and the diagnostic procedures.
Nice segue.
Yes.
Wow.
So
he's getting better and better and better.
We did talk about different areas from the spine and as well as the soft tissues, and then the stuff in the front, the glands. I think the stuff in the front, the ears, eyes, nose, and throat doctor
Specialist, we did
is
that.
going to be the person to go to. If you're having lumps, again, good relationship with your primary doctor, then they can refer you to the appropriate specialist for this stuff here in the front.
Yeah.
In the back, we may see arthritis, and we have the nerves there. So a rheumatologist is the person for the arthritis, and the neurologist for the nerves. Now, I'm a chiropractor, so those are it's in the others, right?
Sure.
But hopefully we are the kind of the primary care specialists in there, because I'm working with the bones, the nerves, the disc, the muscles, ligaments, and tendons. So that complex of soft tissues that may be hindered by the hard tissue of the spine is kind of where we lie and what we look for when we're diagnosing.
Okay.
All right, so that's where the chiro has that broad base, and that's what we deal with every single day, every single case, where the neurologist is just
Hyper-focused.
maybe headaches, the migraine headaches, the radiating pain, hyper-focused, which we're going to deal with the radiating pain, because if I need to refer someone out to the neurologist to do a nerve test, then we'll do that.
Yeah.
Orthopedic surgeons, that's not the first person to go to. You know, the rehab specialists, they're going to be the ones that, if you have more chronic issues, I think that's your bread and butter right there. And
Learn the exercises
yeah.
and
yeah,
strengthen and
well, all of that is definitely important on that rehab, just depending on how it started. But usually there is a weakness. It happened over time.
Yeah.
It just was low grade over time. There's this weakness that happens over time.
and then
For
it got
sure.
worse.
Mm-hmm.
Kind of got worse.
And then I have acupuncturist on the list as well. So that's that's been around for years and years, thousands of years. So
Yeah.
acupuncturists are someone that you can go to. I don't know too much about it, but you can do your research if you're in an area of the world or an area of a city that has somebody that specializes in that Chinese medicine. Man, you might as well go check it out, because they may look at different things to diagnose.
Yeah, it's a different philosophy,
Mm-hmm.
different way of looking at it.
Right. If you have a fever, I don't know if that's the first place to go to. Same thing with me. If you have a fever and you're nauseous, the chiropractor may not be your first stop. But once that subsides and we find out, hey, why is that nervous system acting like that? Maybe there's an arthritic condition that's pinching on the nerve that's causing a sympathetic or parasympathetic response.
Sure.
So let's see what else we have. The medical history. And I think if we differentiate between who to go to first on the medical side of things, which is probably the most common, you're going to get a lot of history, a lot of consultation, and then probably a referral to some sort of diagnostic test, which is going to be either X-ray, CT scan, MRIs, EMGs, even some blood work may be necessary, especially if it's some of that systemic stuff.
Sure.
Going to the chiropractor or a physical therapist who's a medical MPT or a PT/MD, they're going to be trained in the diagnostic procedures to diagnose musculoskeletal. And we go a step further and I'll say neuromusculoskeletal diagnosis. So we're going to look at your motor nerves, your strength, your sensory nerves, your pain perceptions, but also your range of motion, your taut fibers, pain sensations. And then we can also, which I do, is do X-rays right here in the office. So a lot of chiropractors, it's just right there. And to get that X-ray, don't be afraid that that X-ray is, not necessary because you don't want to take that extra time.
That's interesting, because I do see that a lot with folks that are wanting to see a chiropractor. They just want to get in and out. Just
Right.
fix me. I don't necessarily want an X-ray. I mean, what do you do with that?
Well, yeah, I mean, not everybody needs an X-ray. There are guidelines, which we subscribe to, but they are different. Medical guidelines say don't ever do an X-ray unless there's a trauma or the person's over 63 years old. Chiropractic guidelines, if you look at the American Chiropractic Association, and then there's an International Chiropractic Association, their guidelines are very skewed toward taking the X-ray as a diagnostic purpose. Picture's worth 1,000 words here, and the X-ray will give us a posture that's different than just the visual posture.
Sure.
A lot of times. And then if we see arthritis, disc degeneration, there are certain X-rays that can identify fractures of certain parts of the vertebra. I mean, you could have some pain inside, and it could be a broken vertebra that
You
you
have
can't.
no idea.
Yeah, you
You're
can't
be able to diagnose
like-
that at all without
it's-
an X-ray.
Yeah, is pain on palpation? I'm just going to adjust it.
Yeah.
Ooh, you know, you have to be careful there. I'm not going to adjust every single pain.
Right.
Now, we do a lower force type of technique with instrumentation and palpation and using some myofascial techniques. So the safety factor is, you know,
Well,
pretty
it's
high
number
here.
one.
Yeah, it's
That's-
number one.
yeah,
So that's why
yeah.
we do that. But I would say for the investment of time, it takes 5 minutes, and no damage. You get more radiology going to the airport than you do for a neck X-ray. I mean, a neck X-ray, you have this much of your neck. It takes 1/10 of a second of energy for the X-ray to get through the neck. So it's not an MRI. You're there 45 minutes.
Long time in that chamber.
So that's that same thing, longer term. So you have to weigh those risks. So a cervical X-ray, there's no risk. Matter of fact, they'll say sometimes that radiology can be just that little dose can be a positive to oxidation stress in the world. So take that for whatever it is. I don't know. I'm not saying
That's a deeper dive right there.
That's a deeper dive.
That
So-
comes with experience and education, etc. And that was gold right there.
Yeah, so
Thanks,
I mean,
Kev.
my point is don't be afraid of a neck X-ray. Don't not do it. You'd rather do it than not do it to identify any problems. And that's really all the diagnostic tests. When you have that information, then the steps after that can move on forward, and then you can do the treatments and the therapies like in what we'll talk about in part 3.
Yep.
So hopefully that answered that question.
Wow. Yeah, I think it did. It
Okay.
answered it for me, so if it answered it for me, hopefully it answered it for you as well. Thanks for coming along for the ride on this. This is, again, part 1 of neck pain in our pain series. We're so happy to be able to help you, and hopefully you were able to get many things out of today's video. We are the FitHealth Pros. I am Coach Sean.
I'm Dr. Kevin.
And this was part 1. Part 2 will be types of neck pain, so be sure to ring that bell so that you know exactly when that drops. Also subscribe. We have tons of other videos already. We have a bunch already.
Yes.
And we have more coming, and we have more being edited as we speak as well. And we love what we do. We love to help you guys. Part 3 is going to be on therapies, medications, home remedies, and prevention. So again, ring the bell so you know when that comes out as well. Thanks for coming along for the ride. We are more than happy to be the FitHealth Pros
Absolutely. Yeah.
and to help you guys and ladies every day if possible.
Yes, indeed. Thanks again.
See you next time.
Yeah, the definition. Why do I do that?